Oh, okay. Okay, Paul, now we're gonna move to the head and neck region. Are you okay with this?
Yep.
Perfect. I just wanna inspect your neck if you don't mind. Do you mind if I touch your neck?
No, not at all.
Okay. Symmetrical, trachea is midline. Perfect. And now I wanna palpitate your lymph nodes, which I'll be inspecting in front of your neck, behind your ears, clavicle and interclavicle. Is that okay?
Mm-hmm.
Okay, I'm first gonna do your preauricular lymph nodes right here in front of your ear. And I don't feel anything, that's good. Now your post-auricular lymph nodes. Do you have any tenderness there?
Nope.
Perfect. And now your tonsillar. Any pain?
No,
Okay. Submandibular. Any pain?
Nope.
And submental, which is right here under your jaw. And I don't feel any inflamed lymph nodes.
that's great.
And you have no pain, correct?
Right.
Okay. Now I want to do your anterior cervical lymph nodes. These are behind. Your deep cervical. Deep occipital. Any pain here?
Nope.
Perfect. Now I'm going to do supraclavicle, which is right here above. And I don't feel anything. And I'm going to do your infraclavicle. And I don't feel anything there. Any tenderness?
Nope.
That's a good thing. The next thing I want to do is inspect your trachea. If you could tilt your head back. Again, trachea is midline, symmetrical. It doesn't look any problems. Do you have any trouble swallowing?
Nope.
Perfect. And now I want to palpitate your thyroid. So what I'm going to do is I'm going to ask you to lift your neck up and swallow when I instruct you, if you don't mind. I'm actually going to move to feel it better. And if you could swallow for me. Perfect. I could feel your thyroid, which is actually a really good thing for me because I haven't been able to feel the thyroid. But there is no nodules and I do not feel that it's enlarged, is what we expect to see. So the next thing we need to do is the range of motion on your neck. My husband has a neck injury, so I'm not gonna do that. I'll just explain to you that I would have him do his chin to his chest. I would have him put his head to the back, neck to side, but I will test his muscle strength the best that I can. He does not have +5 range of motion, or at this point probably not +5 muscle strength either. So Paul, I'm gonna put my hand behind your head. If you can push and try and push my hand away. Actually, that was really good. And if you could do the same here. He actually did have +5 on the back side of his head and probably a +3 on his forehead. So at this point, I'm going to palpitate your carotid artery and your temporal arteries, if you don't mind. I'm also going to listen. So here's your temporal artery, which I feel, and then your carotid, which again I feel. I'm now going to listen, if you don't mind, if you could keep your glasses off for me. I'm going to use the bell of my stethoscope for this. And the reason I'm doing that, I can hear much louder. I'm going to put this on your temporal artery. Okay. And I'm going to put it on the carotid artery, which I would just do one at a time, so we don't make him pass out. And I do hear his arteries with no bruise. So Paul, I'm going to move to your back now in your respiratory system. If I could ask you to move this way for the camera. So first what I'm gonna do is inspect your back and your spine. And I'm gonna palpitate, is that okay, Paul?
Yep.
So first I wanna look, his spine is symmetrical. His posture is upright. And I'm just gonna palpitate. Is there any tender spots?
Nope.
Nothing?
Nope.
Perfect, and that's what we expect. So now I want to check your respiration excursion, Paul. And what I'm going to do is I'm going to bring my fingers down to the 10th rib of this, besides the spinal column. And I'm going to have you take a big, deep breath in and then a deep breath out. And he does have great movement in his lungs and in his chest. The next thing I would do is measure his AP diameter, his posterior, his anterior, position, which I would do is measure the side and then come around for the front. The side should be 1 and it should be 1 to 2 would be normal ratio. We would see a larger barrel chested and somebody with COPD. Paul, are you a smoker? Perfect, and he does not have a barrel chest, and his measurement looks approximately 1 to 2. Now, Paul, if you could give yourself a bear hug, I'm just gonna percuss to listen for any dullness. And that's wonderful. Okay, so the next thing I'm gonna do is I'm gonna have you breathe in, and then I'm gonna have you hold it, and I'm gonna have you breathe out. And what I'm gonna do is I'm gonna measure. I'm gonna put 2 pieces of tape on your back and take a measurement. Is that okay with you? Perfect. I must be wearing the tape somewhere. Let me grab another piece of tape. Okay, Paul, so what I need you to do is take a really good deep breath in a minute. Take a deep breath in. And then I'm gonna have you deep breath in and hold it. Okay?
Yep.
Go ahead for me. And you can breathe out. And I'm gonna have you again take a deep breath in and then breathe out. Hold it. You can breathe normally. And then I'm just gonna take a measurement in centimeters. Which yours is 4 centimeters, and that's a normal range. Again, if you're a smoker or a non-smoker or somebody who had lung disease, we would see a much smaller range there. And now I'm just gonna auscultate his lungs. I'm just gonna listen to your lungs, okay? And if you could just take a deep breath in for me. And if you start to feel dizzy at all, please let me know. And one more. And he has good breath sounds, no wheezing, no crackles. He's not diminished at all. And now I'm just gonna check his CVA tenderness. Paul, what I'm gonna do is I'm just gonna put my hand on your back right here and just see if you could just sit up a little bit for me and let me know. Any pain? And he has no CVA tenderness. If he did, it would maybe a sign of some kidney pyelonephritis or something along that sorts.